To do the best that we can do for our patients. Thank you so much for your attention. I will just leave this QR code if more people are interested in the work that we are doing, especially in research studies for myopia, and my contact if anyone would like to contact after the conference. Thank you so much for your attention.
Thank you, Dr. Carla. Please be with us till the end of the session for question and answer. Now we'll move for another talk. The second speaker for this session is Dr. Saif Al Rasheed. He is an associate professor of optometry at the College of Applied Medical Science, Qasim University, and the Faculty of Optometry and Visual Science at Nilan University of Khartoum, Sudan. He also served as the Vice President of Sudanese Optometry Society. Rashid earned his PhD from University of KwaZulu Natal in Durban, South Africa, and has participated in 10 national and international conferences. His areas of interest include childhood visual impairment, binocular vision, and the impact of uncorrected refractive errors and myopia control. He has a strong publication profile in the field of optometry. He will speak about public understanding and parental awareness of myopia complications, management, control, comprehensive review. Welcome, Dr. Saif.
Hello, everyone. Thank you for allowing me to present my talk about public understanding and parental awareness of myopic controls. And I'm very glad to present this topic on Paris Sudanese Optometry Society Conference. We are sincerely hope our crisis in our country is stopped soon. The next conference will be in person in Sudan. My sound is good?
Your sound is good, but you need to put the slideshow for your presentation.
Okay.
Yes, you can start.
Okay. Yes, my presentations about public understanding and parental awareness of myopic controls and management and complications. As you know that the current increase in myopia prevalence among children is a major public health concern globally. This because of the significant amount of time that child spent on near activities such as reading and using a smart device. Yes, a recent study shows that genetic and environmental factor such as spending time or spending a lot of time indoor activity and genetic factor are the main causes of high prevalence of myopia globally. Yes, a recent systematic review and meta-analysis found that high myopic prevalence in the children in Asian country and European country and slightly low prevalence of myopia in African children. Prevalence of myopia is the prevalence of myopia is rapidly growing. Scientists predict that by 2050, it is a project that about 50% of the global populations will be myopic. This high prevalence of myopia is commonly due to increase of using of a smart device and the genetic causes of myopia. Yes, why the rising awareness is very important. Yes, the rising awareness about impact of uncorrected refractive error, particularly, especially myopia, is very important as a facilitated early detections and effective management of eye care conditions. As mentioned by Dr. Rajiv in his presentations or his keynote presentations, providing awareness of consequence of myopia is very important. We need to raise the awareness of myopia for community and for the parent. There is a lot of study conducted globally to assess the awareness of the parent or community about myopic complications and myopic control. Yes, the study shows that public awareness of myopic, yes, the public awareness of myopic risk and management option is low. Yes, the risk of myopia or the risk of high degree of myopia and the management option to treatment of myopia is low among community and among parents. For that, this is the rule for us as the eye care provider. We need to raise the awareness of the parent about the consequence of myopia or the consequence for untreated myopia. And also we need to raise the awareness about the community, yes, about the options of the myopic control available in the market, as I mentioned in previous lecture, in previous presentations, the eyeglasses or atropine. All these options, we need to raise the awareness about parents of this community. Yes, the eye care professional should conduct awareness program to educate community and improve the effectiveness of myopic control. Yes, now the role of eye care provider. Yes, the role of eye care provider is to raise the awareness
Dr.
of.
Saif, now the sharing is stopped. Can you share your presentation?
Okay, now you see the screen.
Yeah, but yeah, it's great.
Okay, ready? As you mentioned, the eye care professionals such as the optometrists and ophthalmologists need to increase the public awareness and parental awareness about the myopic control and consequence of uncorrected myopia. Yes, yes, as eye care provider or as optometrist, we need to know who is at risk for myopia. Yes, myopia risk factor include genetic and environmental factor, while the genetic factor yes, cannot be changed. The lifestyle can be changed and can be reduced, can be reduce the environmental risk for causes of myopia. As we mentioned before, most of studies say that the leading causes of myopia is the genetic and environmental factor. Yes, the genetic factor we cannot play on this. It is a difficult, but for environmental factor, we can play on the environmental factor to change this environmental factor to reduce the high prevalence of myopia. Yes, such we as we are as the eye care provider, we need to understand and raise the awareness of the public and the parents about the risk for development of myopia, such as the near activity. The near activity, for example, the near activity increases the risk for development of myopia by 2.5, and screen time. If the kids or if the children spend a lot of time on the screen time, this may lead to increase the prevalence of myopia by 6 times. And if also if the child spent less time, yes, spent less time, this spent less time or spent less outdoor time, this spent less outdoor time could lead to increase or to lead to increase the risk for development of myopia by 1.5 times. Yes, and also living in city. Also, some studies say that living in city increase, yes, risk for development of myopia by 1.5. And low light, if the child is working or is if working on low light conditions, also these low light conditions lead to increase the risk for development of myopia. Yes, we as eye care provider, we need to raise the awareness about the community and about the parent, about the environmental risk factor. We can play on this. We can play on this. We can raise the awareness about the parent, about the community, about the parent and the community for the risk factor, environmental risk factor. This reduce the prevalence of high myopia. The other factor that lead to increase development of myopia, like genetic factor. The genetic factor is difficult to play on it, but we can also raise the awareness of the parent about if the one parent have a myopic, this increased risk 2 times for development of myopia. If the two parents have a myopia, the child have yes, a possibility of 5 times to become myopic. And also the ethnicity play part on yes, the preference of myopia, like some study found about yes, South Asian children yes, have a 9 times high risk for development of myopia, and this risk is slightly low in African and other ethnicity. And also severity of myopia and risk factor, we need to raise the awareness yes, of the parent, of community about the severity of myopia. If the myopia increase, degree of myopia, yes, ocular conditions that associated with myopia is increases. Yes, worsen are good. Yes, high myopia level, increased risk of retinal detachment, increased risk of glaucoma, increased risk of macular degeneration, risk of cataract. With the awareness of the community, of the parent about this, we say to the parent, if the high degree of myopia, if myopia left without interventions, if myopia left without the control, could lead to retinal detachment, could lead to macular degeneration, could lead to cataract. We during the eye examinations, we need to raise the awareness of the parent or of the community about the consequence of and control it. Serious eye conditions are more commonly with high degree of myopia. If myopia become more than -6, some serious eye conditions. Yes, commonly myopia classified as mild myopia, moderate myopia, and high myopia. So study found that, for example, the macular degeneration, the risk of macular degenerations increased about 41 times in high myopia compared to yes, the risk for the retinal detachment increased about 22 yes, time compared to the child with the low degree of myopia. And also the complication of basilar subcapsular cataract increased about 5.5% in high myopia compared to yes, low myopia. And also glaucoma, yes, there is increase in high degree of myopia. For that, it is very important to increase the awareness of the parent about, yes, if the myopia is still in mild degree, the risk for ocular complication is low. But if the myopia left without interventions or without control, maybe the myopia developed to high degree of myopia or high myopia. The high myopia have a serious effect as shown in this picture. And also there is syndrome called heavy eye syndrome. Yes, myopia induces strabismus. Yes, this myopia induces strabismus. Yes, the elongations of the axial lengths lead to eye to be slightly to the lateral side, and this lead to esotropia, some strabismus or convergent strabismus associated with high degree of myopia. Also, this is the complications of high degree of myopia. And also we need to raise the awareness of the parent or of the community. If myopia is untreated, may also lead to heavy eye syndrome or myopia induced strabismus. Yes, for that, measuring of axial length is very important during myopic control and during follow-up of the child. If you find the axial length more than 29%, this may lead to heavy eye syndrome. As mentioned, heavy eye syndrome may be induced strabismus or convergent strabismus or esotropia associated with high degree of myopia. Yes, and we can ask this question to ourselves: why is the early intervention is important? And also, we can deliver this information to the parent. Yes, the early interventions reduce the likelihood of development of high myopia. Yes, and it is associated factor. Yes, if the myopia is developed to high myopia, that leads to a lot of complications, as we mentioned is before. But if we use interventions such as any device lead to control myopia or lead to stop or slow progressions of myopia, the child may be just on yes, a mild degree of myopia. That is good. But if this the child left without an intervention, this myopia may be developed to high degree of myopia, and we know that high degree of myopia is associated with a lot of eye complications. We need to deliver these informations to the parent and to the community to understand the risk of high myopia. Yes, myopia may also impact the quality of life if not addressed. Yes, and also the options, what main options are available to down worsening myopia. This question is important for eye care provider or for optometrists to understand the recent option for slowing myopia or the recent for treatment of myopia. It is yes, like eyeglasses we can yes yes deliver this knowledge to the parent, to the community. There is a new eyeglasses. That new eyeglasses lead to yes to slow worsening of myopia, and this eyeglasses, this new eyeglasses is different from traditional corrections of myopia. Like the traditional corrections of myopia lead to hyperopic defocus, and this hyperopic defocus commonly lead to yes progressions of myopia or lead to increase high degree of myopia. We need to yes increase the awareness of parents. This type of glasses is traditionally glasses for myopic treatment. Yes, and also we need to tell the community and to tell the parent about the advantage for my role, like advantage. It's easy to use, and also the considerations. Some child may have activity or may have active life style that may require alternative treatment. The alternative treatment cleanse. Yes, and also we need to increase awareness about the type of the contact lens available in the market or available that lead to slow down, yes, myopia, like soft contact lenses. And also now, many studies show is that also keratology is a good options for slowing down myopia. This is a very good options. Also, we need to yes increase the awareness of the parent and increase the awareness of public about this type of new yes device or new method for or new options for control of myopia. And also the advantage, and we can tell the parent about the advantage, the contact lens where it's suitable for active lifestyle and likely to improve the child self-esteem. And also we tell the parents about the considerations that need to take for this, like proper hygiene is required to minimize the risk for eye infection. Yes, now there is a lot of study, as I mentioned by the previous patients slow down worsening of myopia. Also, we need to the awareness of the parent and awareness of the community. The atropine eye drops are applied at the bedtime to slow down the progressions of myopia. And also, we can tell the parent about the advantage of these methods. A parent can help to ensure the treatment plan is being followed. And also we need to tell him the considerations, yes, the consideration or the side effect associated with use of atropine in control of myopia, like a temporary, yes, like a temporal side effect, including light sensitivity, blurred vision, atropine. And also, this is a very important point we need to tell the parent. Atropine does not correct the child blurred vision. So the eyeglasses or contact lens will be required. Yes, the atropine is not lead to correct the vision, just to slow down the progressions of of myopia or to slow down the progression of axial elongations. For that, the child who uses atropine for control myopia need to use his glasses, eyeglasses, or contact lenses. This is a very important information. So we need to deliver this to the parent. Yes, this options of the treatment of myopia is available in, for example, in office or in clinic. Other treatment or other management of myopia at home. Also, we need to increase the awareness of the parent about the management of myopia at home. Yes, lifestyle change or lifestyle modifications. Lifestyle change or lifestyle modifications. This home therapy to control of myopia, like lifestyle change. Yes, a lifestyle change can help delay or slow down worsening of myopia. Yes, increased time spent outdoor activity. Spend at least 2 hours daily outside could lead to slow down the progressions of myopia. Yes, the study found that if the child spent less than 2 hours, yes, in outdoor activity, this lead to increase high to lead to develop of myopia or lead to increase high degree of myopia. For that, the study recommended that at least the child spent, yes, at least 2 hours per day on daily activity. Yes, the recommended daily activity like a visit park or beach, engaging in outdoor sport like football, swimming, or cycling. Or a new study or recent study found that if the outdoor activity is spending in sport like football, yes, give better result than other activities. We need also to increase the awareness of the parent about the home therapy or management of myopia at home by increasing the time of outdoor activities. Yes, and also reducing the time spent on close-up activity. Yes, a recent study found that the
2
child
minutes.
spent a lot of time.
2 minutes.
Okay, the child spent a lot of time lead to high degree of myopia. Also, we need to, yes, the child to reduce the time spent on close activity. Yes, encourage the child to take a break while doing close work or, yes, at home. And also, it is recommended that they take break after 30 minutes. If the child, yes, read, yes, it is better to take a break after, yes, 30 minutes and increase the distance between them and the material or the books when he read. Yes, and also there is other set up time limit on the phone screen. Yes, some recent study recommended that for the children older than 5 years, aim for no more than 2 hours of screening time per day. And for the children, their age between 2 and 5, yes, less than 1 hour. Yes, for the children less than 2 hours, sorry, for children less than 2 years old, screening not recommended. Yes, we need also to deliver this information to parents. This is a very important information. We can deliver this information to parent to control myopia at home. Yes, and also we can give the parent like a template to check up the daily activity of the child, like the child spend at least 2 hours of outdoor activity per days. Yes, include yes, simple look book like this template. We can yes, share this template with the parent to monitoring the time or the activity or the management of myopia at home, like the child spent, yes, in morning, afternoon, evening, and also the type of the glasses or contact lens he used. If there is any symptoms, time spent on close activity. Yes, the time the child is spent on close activity, and eye drugs if the child use like atropine for control. And also we can yes, ask the parent to mon to monitor this if the child follow this advice recommended management protocol for myopia, follow-up outdoor activity recommended at least 2 hours per day. Follow the reading distance recommended, yes, 30 centimeter away. Follow the screen time recommended, and yes, the right eyeglasses or contact lenses. This is a very helpful template. We can share this with the parent to monitoring or to help to assess their home therapy to control of myopia. Yes, and why the annual examination is very important. Also, this is very important. We need to raise the awareness of the parent and community about the annual eye examination. Child need regular eye examinations to ensure healthy eye and development and to detect vision problem like myopia early. Yes, kids often don't realize that they have vision problem without eye examination. For that, the eye examination is very important. So kids show signs like squint or sitting close. This may give signs of myopia, but sometimes there is no any signs of myopia. For eye care professional, yes, for eye care professionals such as optometrists and ophthalmologists, it is better to provide counseling. Yes, it is better not just to prescribe eyeglasses for the parent. Now myopia become as a disease. You need to deal with the myopia as a disease. We need to deal with the myopia as the protocol. You give him protocol and you need to follow up this child, not just to write prescription of eyeglasses and let him to use glasses. Yes, we need to deliver consistent messaging about myopic control and method of the control available, and also education on potential complications. This is very important. The need or eye care provider need to raise the awareness about the complications of myopia. If anyone understands the complications of any things, they can take care of that things. We need to increase the awareness of public parent about the complications of myopia. Yes, the conclusion.